Health literacy is defined as the ability to understand healthcare information that you're given and utilize that information in a way that is helpful for you. As clinicians, we have a responsibility to the patients that we work with to make sure that we understand their health literacy limitations and adjust their patient education according to what they need. Through the research that we saw this week, we can see that a lot of people struggle when it comes to understanding what their healthcare providers are telling them, and they have trouble understanding a lot of the words that we use and a lot of their instructions, but they don't want to admit that. The biggest connection I see between what the literature said and what I've seen in my own practice is an unwillingness to read documents in front of the provider. A lot of the times I will have patients take it back and say that they're going to read it at home or go over it at home, but there's no proof that they are going over it, and there's certainly no proof that they're understanding everything that they're reading. I see this a lot with our concussion protocol and our concussion information paper. A lot of it is probably a little bit out of their understanding, but no steps have been taken to correct that. Around 35% of Americans have a lower than an intermediate level of health literacy. And health literacy is something that affects everyone. It doesn't matter who you are, race, income, age. It affects everyone. So this is a big deal. It seems like the best way to increase health literacy is through the grapevine, as Dr. Fitzpatrick said. All clinicians everywhere need to do their part to help increase their patients' health literacy through patient education, and the word will spread from there. Additionally, we need to make sure that the patients are understanding their patient education, and their literacy levels need to be kept in mind throughout this process. So we need to make sure that we're using language that's comfortable for the patients. It's not about us, the clinician, it's about the patient. So we need to make sure that as we're explaining things, we're explaining it in a way that they understand and are comfortable with. It's recommended that we present our patient education information between a 5th and 6th grade reading level. This is to make sure that those considered to have health illiteracy can understand what we're telling them, but it never hurts to make things easy for patients to understand. So even for those patients that have a higher literacy level, it's not going to insult them to make it easier to process and understand and utilize. It's also important that we make sure any documents we're giving the patients are fully explained before they leave, and then they're easy for them to pull out again later and still understand afterwards. Something that clinicians are seeing a lot of is the information that the patients are receiving is being forgotten right after discharge. It was found that when there's a large amount of information given, almost half of it is recalled incorrectly and not much of it is recalled at all. So one thing that we really need to focus on is the individual needs of the patient, not just increasing their understanding of their health needs, but increasing their overall health literacy. Low health literacy levels can lead to more emergency room visits, longer hospital stays, less compliance in patient education and patient instruction, and even can lead to death. And outside of that, it's also very, very expensive for the patients and the healthcare system. One thing that has been shown to work in mitigating the risks of low health literacy is using the teach-back method. This is where the patient will repeat the instructions they are given back to the provider so that the provider can make sure that the patient understands everything, and then the provider can modify things as needed. And then additionally, it gives the patient a safe space to go over what they're supposed to do, and then they can ask questions where needed. These days, it's been made easy to get in touch with your providers to ask questions through email, text messaging, the app on your phone for the hospital or doctor's office that you use, but these resources are not easily available to everyone. This method will ensure that the patient and the provider are on the same page. I've used this method a lot with the athletes that I work with because a lot of the times I will tell them what to do and then later find out that they didn't understand an exercise, they had never seen it before, and they didn't know how to look it up. So now what I do is make sure to demonstrate the exercise and what I want them to do, and then I have them do it as well so that we both understand what's happening. And I understand that they know what to do, and then they understand what to do.